Morning, June. How are you?
Amid the fears of a second wave, the memories and the devastation of the first one still linger.
You know, after the virus, he's coming to see what it's like if we're back to normal.
Oh, we're trying now.
We are trying, aren't we?
Anita Astle saw almost a quarter of her residents die of COVID-19 at the height of the pandemic. She feels she still doesn't have the support of ministers should things get worse.
We really suffered in the first wave. The guidance that's come out around visitors is not what we'd want it to be, and so I have no confidence that the government is going to have our back or, as Matt Hancock said, provide the ring of steel around care homes.
This is our isolation area.
In April, we highlighted the struggles Wren Hall nursing home was enduring. In lockdown, Anita filmed these pictures of their so-called red zone, where residents with suspected symptoms had to isolate. 13 would eventually die. As things are gradually restored to normal, Anita has now allowed us to film inside the home.
These are normal bedrooms now, and the lounge area has returned to what we call Garden Road to look after those people.
These days, there are no shortages of PPE.
Ray, can you just wash your hands? Yeah. Just give your hands a little wash, ready for dinner.
And there's never been a lack of TLC.
Ready?
We've also been in contact with staff at Tregwilym Lodge Care Home in Newport, South Wales. Here, they lost so many so quickly. At the time of the first wave, the advice in Wales was to only test those with symptoms. They now believe 21 deaths can be linked to COVID-19.
I am unaware of the plans on what's going to happen if we should hit a second wave. So there's been no engagement in respect of whether we're going to have extra staff, whether we've got enough PPE in the system, the flu jabs in respect of our staff and everyone making sure we're covered. And that's quite worrying as we move into August. And dependent on when the flu season hits or the second wave hits, if we get one, then clearly that is also a very worrying time.
Can I take your temperature?
But it's staffing that's the most worrying and pressing issue at a group of care homes in Norfolk.
You've got a cold head today.
The sector is drastically short of staff as some temporary workers have returned to reopen bars and restaurants. Jasmine, who usually works in human resources, is now providing care.
Full PPE on, as you can see. Have to wear the mask at all times during the time that I'm in the home. Got a little bit of rash on my face here, and on the edge of my nose. It's okay, I'm getting a bit tired. I've been on my feet, haven't had a chance to have a break yet. And to be honest, given that I've only done shadow shifts so far and I didn't really manage to get a break on those, I don't really reckon I'll get one today.
Back at Wren Hall and in so many other care homes, testing remains a huge problem. The government promised staff would get a COVID-19 test every week, residents every month. But Anita has been waiting 3 weeks for the testing kits to arrive.
So you can't even sort of meet the government guidance about testing residents and staff because you just don't have the kit here?
No, we don't have the kit and we can't get them.
And how frustrating is that?
It's really frustrating because we want to keep everybody safe, particularly because of asymptomatic transmission. We don't know who's got the virus or not. So the only proactive way of managing this is to test people regularly.
Downing Street has acknowledged what they've described as unexpected delays in the testing programme. Many improvements have been made since the horrors of the spring. The autumn, the winter may bring new challenges. Julian Drucker, 5 News.